Hi, everyone. Thanks for including our project. I will be quickly introducing the Hamilton Family Health Team's Green Initiative. Our goal is to provide practical help to improve environmental sustainability within primary care in Canada. We are happy to share our tools with everyone at this conference, and we really welcome collaboration. I'm Dr. Megan Davis, the lead, and here as well as our project manager, Tia Gajowski. We both work at the Hamilton Family Health Team, which is the largest primary care group in Ontario, with over 160 physicians, 250 staff, and allied healthcare team members. We began in 2019. The data from the UK shows us the hotspots of emissions from primary care, and the orange boxes tell us how important it is to consider the carbon footprint of our care, not just our energy use, water, and waste. After looking at this data and listening to Dr. Andrew McNeil speak at this very conference 2 years ago, we decided to focus on enabling high-quality, low-carbon care. We looked beyond the obvious initiatives like garbage recycling in the visible part of the iceberg shown here, and instead focused our efforts on topics that we are really good at in primary care that improve the health of our patients and simultaneously our planet. I will quickly go through these 5 focal areas and then introduce the tools we created to help us move from thinking about this, talking about it, to action. We started with metered-dose inhalers, as the data showed that they have a huge carbon footprint, accurate diagnosis of COPD and asthma, evidence-based prescribing, and ensuring proper technique improve our patient care, and it combats climate change by avoiding unnecessary puffer usage, which potentially reduces metered-dose inhaler prescribing, because 1 metered-dose inhaler is the equivalent of a 290-kilometer car journey in emissions, and there are over 900,000 just salbutamol metered-dose inhalers dispensed per month in Canada. Next up is plant-rich eating. The evidence is solid and significant for its benefits for cardiovascular disease, diabetes, GI issues, cancer prevention, mental health, and more, as well as decreasing the substantial impact of animal agriculture on the planet. Next week, we are presenting on disease prevention, which improves health and also reduces the intensity of healthcare and therefore lowers its environmental impact. We will focus on tools to help screen for cancer and increase smoking cessation. The webinar invite is in the showcase. In the spring of 2023, we will look at how to reduce unnecessary tests and treatments, which leads to better patient outcomes and decreases the intensity of healthcare required. And later, we will introduce the literature and tools for prescribing nature, which improves mental and physical health and promotes pro-nature conservation behaviors. Our project also includes documentation of the efforts of our 2 pilot sites to reduce waste and emissions from clinic operations. Many of these initiatives in this category were inspired by CAPE's Climate Change Toolkit. We measured our reduced impact, cost savings, team benefits, and we documented them in a series of infographics. We have created a smorgasbord of tools for all of these components. This is a really practical project. We are enabling primary care to address climate change in our work. Our resources are free. They're available to all of primary care. They're evidence-based, interdisciplinary, and they're tested for practicality at our 2 pilot sites, which includes my office. Let's go through some of our tools. We host a website that contains all of the tools and resources and guides. It's very well organized. As one recent new contact kindly said, "Your website is a work of art." Our monthly newsletter creates community, invites engagement, celebrates successes, and shares resources. We've created 20 so far. Please join our distribution list through the website. Our webinar series are accredited with the College of Family Physicians of Canada for 3 main Pro Plus credits per hour. They roll out our topics in a modular fashion. They're free, they're open to your whole team, interactive and engaging, with a quiz and even some prizes. We've delivered 7 so far on 2 topics, metered-dose inhalers and eating plant-rich. We are happy to have reached 24 family health teams in Ontario and a few groups in BC, Manitoba, Alberta, and PEI. Our worksheet gives easy-to-follow steps and resources for setting goals and measuring progress. We have a series of how-to guides. Each one lists really specific details and all the environmental benefits, the tools you can use, the cost details, alternative options, obstacles, and everything our team discovered while trying them out in our primary care offices. We have a laminated series of 15 posters we can mail out to you. So far, we've distributed over 1,200 across the country. We have made 2 different patient-facing videos, which anecdotally I can tell you from my own patients, they do come in from the waiting room asking about how to eat more plants and sharing as well that they're motivated to get into nature more. We offer a virtual patient education group about plant-rich eating that is led by a registered dietitian. It's available by patient self-referral, and it's open to all patients in Canada. Thank you so much for listening. We do encourage you to get in touch. Instead of reinventing the wheel, let's all get it rolling together. Bye, everybody.